The brain and spinal cord can be separated by white matter and gray matter. White matter is composed of dense, mostly myelinated cells. Gray matter, on the other hand, is composed mostly of the cell bodies and unmyelinated axons. Neurons can be classified by the speed of conduction and their level of myelination. Group A neuronal fibers have a large diameter and are thickly myelinated. These neurons are mostly somatic sensory neurons involved in reflexes. Impulses in these neurons travel up to 150 miles per hour. Group B fibers are lightly myelinated and have a smaller diameter. Impulses in these neurons travel much slower at around 15 miles per hour. Finally, Group C fibers have the smallest diameters and tend to be unmyelinated. They conduct impulses at 1 mile per hour or less. Issues in myelination characterize multiple sclerosis, an autoimmune disorder. In this disease, the myelin sheaths are gradually destroyed and cause the formation of scleroses, hence the name. Because of the loss of conduction in affected neurons eventually ceases. Multiple sclerosis is characterized by periods of remission and relapse. This is thought to be because the T cells only attack glial cells, not the actual axon. Thus, eventually the neuron starts adding sodium channels to the empty spaces once occupied by the myelin sheath. Symptoms of multiple sclerosis include muscle weakness and paralysis, speech disturbance, and urinary incontinence, loss of control of one's urinary sphincter, resulting in uncontrolled urination. Multiple sclerosis can be diagnosed by a lumbar puncture test. In this test, a sample of cerebrospinal fluid is extracted and the level of myelin basic protein is analyzed. In levels of over 4 nanometers per liter, there is likely degradation of the myelin sheaths. As of now, the most common treatment for multiple sclerosis include immunosuppressant drugs inhibiting the activity of the immune system, thereby decreasing the degradation of myelin. Recent research has shown strong links between multiple sclerosis and a specific protein, myelin basic protein, and how that affects the reactivity of T cells. As described earlier, myelin basic protein tends to elevate in patients with multiple sclerosis. The research has led scientists to believe that T lymphocytes target foreign antigens, but they cross-react and accidentally attack the myelin basic protein found in glial cells. This causes the eventual degradation of the myelin sheath.
Created using Powtoon.